Hello, my name is Dr. Arthur Mcunu. I've dedicated my life to providing surgical care to patients with heart disease. My life began in the slums of Soweto in South Africa, where I learned to overcome adversity and illnesses, including the death of my best friend. That's why I want to be a resource for you and your family for consultation related to heart and cardiovascular needs. You can learn more about me by visiting my website, which is at zuluchaskada.com.
Thanks again. We're really not deserving of the applause, but thank you. We do appreciate it. Welcome back again to the Roland GRIMES Sports and Entertainment Show. I'm your host, Roland Grimes, and once again, I want you to join me in applause as we re-welcome my esteemed co-host, Mr. Self-Empowerment, ladies and gentlemen, Wilbur Skipper. You know, I'm always excited when I have three other distinguished looking gentlemen on the set with me. And it gives me a chance to, one, sort of showcase and feature some of the talent that we have here in the Washington, D.C. area for you across the world to see. You may hear a lot about Washington, D.C., and some of it might not be so good. So we're going to show you how good we can be. Ladies and gentlemen, I want you to join me in re-welcoming again Dr. Arthur Mcunu and Mr. Eugene Hellams. Now, for you English majors out there, I know there's no such word as re-welcoming, but it is now. Okay? So look, this is where we're going to go with this. Folks, Dr. Mcunu, in our last set, you talked about some of this health gap. Mr. Hellams, you talked about some of the things that we need to do to improve our health. So here we have someone who is working with us, Skip, on the front side, and here is someone who is working with us on the other side, especially when I want to say problems occur. And of course, if we live long enough, there are going to be difficulties. So you can be a healthy person instead of difficulties, I do believe. But somewhere in between these two gentlemen is a wonderful opportunity for us to improve our health. Now, I don't want to bring your business down. I still want your business to grow, but I want it to grow naturally. And I think you do too, based on our conversation. So part of your consultation, when you're meeting with people, and obviously you do pre-consultation, even with people like me, to talk about the things that we need to do to improve our health. What are some of the tips, strategies, thoughts that you pass on to other people at this stage of the game, long before we have to come and see you?
Yeah, that's a great question. One of the things that people don't appreciate with heart disease, number one, it is the leading cause of death in America. That has not changed for years. One thing that people don't appreciate is that once you have been diagnosed with heart disease, you have to have a lifestyle alteration. You have to change your lifestyle. That means that if you want to sustain the results that you receive, let's say we did a bypass, you have to then start to live healthier. You have to make healthier choices. You have to bring down a lot of the risk factors that we know contribute to heart disease, such as controlling your blood pressure, such as controlling your diabetes, bringing your cholesterol down, and all of those, bringing your weight down in terms of exercise and increase your conditioning. So those are the lifestyle changes that become necessary. Decrease salt intake, particularly for us as African Americans, we tend to be more salt sensitive. So we have to decrease our salt intake so that we can decrease some of the progression of this condition.
Okay, now Dr. Mcunu described it as once a person is diagnosed with heart disease, they have to make a lifestyle change. You're telling us that we need to make lifestyle changes so we avoid, or at least delay, being diagnosed with heart disease. In your role, you talked a little bit about it earlier. Maybe you can hit it, especially after hearing Dr. Mcunu talk about his extraordinary procedures. What do you tell folks that you think can help them in terms of their overall health, especially when it comes to their heart?
Well, one of the things I would tell them is first of all, it is the nutrition part, because when you eat a lot of fatty foods, like far as your fried foods, that contains like a lot of the fat that will break down into your system, and in retrospect, it will overpump your heart. So going from fried to lean food and also baked food will lessen the conditions as far as you getting any type of heart conditions or any other ailments that can go from there.
Okay, before you jump in, here's the thing. Recently, and I know that you and I have discussed my working out with you, and of course, we work out in the same arena, and though he says I'm inconsistent, he'll tell you I'm consistently in there. However, recently I ran into someone who was absolutely psychotic, and I decided to work out with this person. This person had me run up and down a flight of stairs, 8 flights of stairs like 20 times, and then walk for 3 miles afterwards. Now, somewhere along the way, I know, right? You see your face. Somewhere along the way, I was wondering, now, is this good for my heart? Or is it not? Because my heart, you talk about overpumping. Okay, so my heart really didn't slow down until like 4 minutes ago. And this workout was 3 days ago. So is there such thing as overpumping the heart while you're exercising, or do you just, jump in the water and just get it on?
Well, you want to jump in the water, but not too large of an extent. But one thing is that if you haven't worked out in a long period of time, and you start to say, okay, I'm going to start working out now, like as far as doing those weeks running, that's going to increase your heart rate. And
oh yeah, it did.
I'm sure it did. Once it increased the heart rate, now your body's like, oh my goodness, we're doing something that we haven't done in a while. So now now everything starts to jump up at a different level. So now your heart is pumping, your muscle regions are really getting pumped up, and now your focus now. So now all of that energy is going right to that particular heart to push out everything. So therefore you're able to complete your goal. Now, once you're done, that's when your body starts to relax, but your heart is still pumping. That's because you haven't done it in a while. So therefore, that's where you have to start your breathing mechanisms. One of the things that I tell people, I say, when you're working out, make sure you breathe. Make sure you inhale through your nose, exhale through your mouth. Why do we say that? Because we want to make sure we slow down the heart rate and keep our pulse level at a level where it's between 67 and 72. But if you haven't worked out, it's not going to happen that way because your pulse rate can be anywhere between 75 and 85. And then that's sometimes you can feel that particular.
Yeah, the person told me breathe through your nose, exhale out your mouth, and I was like, look, if I could just breathe,
Okay, well, I have a 2-part question. First is for Dr. Mcunu, and then the second is for Eugene Hellams. Dr. Mcunu, we talk about preventive maintenance. We talk about all the things that we should do to prevent us from being in a situation where we have to come see you. Talk to us a little bit about the warning signs. Give us some of the warning signs that people need to pay attention to, even though they may wind up seeing you, but maybe they don't have to see you by being rushed to the hospital in an ambulance or passing out. Can you talk to us a little bit about that? First, Eugene, I have a question for you after that.
Sure. One of the things that is important to point out is that there are certain traditional and old descriptions of symptoms where people expect an elephant to sit on their chest, where they expect to have pain that shoots down the arm. Not every patient experiences that. In fact, a lot of diabetic patients never have pain at all. So they can actually experience shortness of breath all of a sudden out of the blue. And that could be one of the first signs. And in women particularly, we have discovered that women, one of the reasons why there's been delayed in diagnosing women with heart disease is because they do not have the traditional symptoms that men experience. One of the most consistent symptoms that is important not to ignore is that of having a sensation of feeling sick to your stomach. If you have nausea, you just feel sick to your stomach and you have no other explanation for that, you should take that seriously because that could be the only sign or symptom that you have that something is going on with your heart. And so you should seek medical attention. Some patients can experience what we call tooth pain, where you have an incisor that hurts. And you know you've just been to the dentist recently and your teeth have been declared healthy. And all of a sudden you have this incisor pain and you know that there's no reason why you should have that. Those are some of the tiny little things that we should be looking for. Palpitations of your heart, of course, those are big ones. What I always tell patients is that if you have a loved one who experiences any of those symptoms, the first thing you should do is grab an aspirin at home. You don't want to take the aspirin and swallow it. You want to chew it make sure you bite down onto it so that you can have that aspirin into your bloodstream as soon as possible to stave off the chances of destroying your heart.
Hey, Skip, we're going to delay. We're going to come back after the break, and you can get into Eugene Hellams. Hey, folks, Roland Grimes, Sports Entertainment Show. We'll be right back at you in a few minutes. Thank you. Once again, thank you. You're getting a lot of exercise just from clapping, so Mr. Hellams is very happy. Hey folks, Roland Grimes back on the set. Skip, you had a question for the fellas.
Mr. Hellams, when it comes to a patient, or let's say someone who's had some ailments, and let's say they just finished having a procedure with Dr. Mcunu, and now they find their way into your office, what are some of the things that you're going to do with that patient to make sure that they regain some of the physical stability without putting themselves back in a bad state where they may have some other things
Great
happening?
question.
Right, that's a good question. Well, the first thing we do, once we go down the list and look at the information regarding their ailments, we want to do is that we want to make sure we set up a nutritional plan first and foremost. And I'm sure the doctor already had a plan for it. We make sure we abide by that plan. The second thing we want to do is that we want to make sure it's going to be a marathon. So we want to make sure we start off slow. So we want to make sure we do a walk and see how what a walk does, at least for a good half a mile, depending upon the severity, or up to a mile and a half. As we do this, we call this a talk test. And the talk test is that as you're walking, we're talking to you. If you have heavy breathing, then we know that we need to either do one or two things. Slow down the pace, which is duration, or slow down the length. So once we do that, that's when we start tracking that particular system as far as, okay, we're going to go from 1 week to 2 weeks. Now this is going to be our 2-week goal as far as extending the duration, and also making sure that we extend it where we might do some heel intervals to see how well that the heart will be able to take before we start doing strength training. Because if you do strength training too early, what happens is that you over pump the heart and you go right back to the hospital.
Well, now, Dr. Mcunu, in regards to the procedure that you're performing at Howard University Hospital, how long does it normally take, let's say after bypass surgery or the repairing of valves, before a person can get back to some sort of normalcy in terms of the way they were living before, providing that they follow a nutrition plan and do all the things that they're supposed to do?
You bet. Usually we're pretty tough on the patients. We're going to make you walk. As soon as I take the breathing tube out, which is usually 4 hours after the operation, that evening I have you out of bed. So we start the exercise program right away. In general, it takes about 8 weeks for the breastbone to heal. So by 6 to 8 weeks, most patients are able to get back to their usual state of life. This is intended mostly to take away the concerns that you have with some of the interruptions in your quality of life, and so you should be able to go back. Even though I had a patient who asked me one time, "You'd like this?" and
where can they have sex? Right? That's what they asked you.
They always ask me that.
That's what they asked you.
That's always one of the questions, and I always tell them as soon as after 2 weeks, usually we'll say to answer the question. But avoid the chandelier.
I haven't avoided it. Excuse me. Go ahead.
Sorry. The other one is I had a patient who actually requested that he wanted disability. He's a young guy, and he said, "Doc, I want you to fix my heart, but I don't want you to fix it so good that I can
It's called illegitimate.
Something might have been wrong with his heart, but his brain was functioning. So did you? I mean, how do you handle? I mean, I know how you handle it, but just for the record, how do you approach that kind of situation?
Well, you had to laugh, and I mean, the bottom line is that I established an excellent relationship with my patients and my family. With this gentleman, we just laughed, and I said, "Look, man, there's no way I can go in there and just partially plumb your system. I have to get you back to good shape." And he laughed about it. He said, "Yeah, I don't want that pain anymore." So at the end of the day, he wanted to feel better, and he just did not relish the idea of going back to work. But,
Super. As we close out, let's talk a little bit about those relationships. We have about 2 or 3 minutes left. Tell me about some of the tell us about the kind of relationships you want to establish with the people that you work with.
Well, the biggest thing I want to establish with the people I'm working with is having a rapport of comfortability where you can actually talk to my staff members. Like I said, this is a business which is was set up through my grandmother when she passed when she was 87 years old. She was a fitness guru, and from that point on, that's when I actually started to have it where it's close niche. I didn't want to be a situation where nobody can go out there and get the information. So I'm always asking, say the biggest problem that most people have is not knowing, and that's what we're here for. We're here for to make sure everybody understands first, and then once we get through that, then the training will come. But it's all about knowledge. It's all about the information, because you don't want to go out there and overwork yourself and then get injured, or underwork yourself and not be able to achieve the goal that you're looking to achieve.
Okay. Now, Doc, are you still getting cards and letters and edible arrangements from people that you worked on over the last 15, 20 years?
I do. I get one. It's funny. Before we left, my wife has gone to a party with a friend of hers, and she went into my stash. I had a gentleman whose wife came in with a heart that was almost dead, and I operated on her, and we wrestled her from the jaws of death. And every year since then, he sends me 2 bottles of wine a year. And so that is one of those gifts that we get once in a while, that this is what it's about. It's about reconnecting families and having them laugh and be able to do things that they were not able to do.
So, Skip, we got about 1 minute, 30
Well, I would
seconds.
just like to say, I want to commend both of you guys. I mean, you're helping people get back into shape. Preventive maintenance is a big part of what you do. Dr. Mcunu, you and your wonderful staff at Howard University, you're saving people's lives. I mean, that's not something we should take very lightly. And I just want to commend you guys for it. I'm just in awe. I mean, this has been a fantastic show, and hopefully everybody out there that's watching the show, you are a lot more educated now than you were before we had the show today. And if you're not, please go to our website, www.rolandgrimesshow.com. You can follow both of these gentlemen and the great work that they're doing. Please follow them.
Great. Look, we want to make sure you guys stay in touch so you can continue your relationship beyond this point. Hey, you met Darren Heath, you met Dr. Mcunu, and of course, one of my fitness experts, Mr. Eugene Hellams. This is the Roland Grimes Sports and Entertainment Show. I'm your host, Roland Bubba Grimes. We'll see you shortly for the next edition. God bless you. We'll be in touch.